You've been in practice for almost 50 years and have written over 21 books. You've got some clinical insight I want to know about. Dr. Devaki Berkson, our guest today and friend for many years, is that clinician. We're going to talk about why some of the therapies that were so successful a decade ago are often ineffective. Welcome, Dr. Berkson. It's great to have you. Dr. Berkson, you have developed some products to detoxify receptor sites, and I've heard so many dramatic stories, one of which was a nutritionist who's a yoga instructor had these 5 pounds that she couldn't get rid of. I mean, she fasted, she did a detox, she increased her exercise, she was in perimenopause, but when she started taking Receptor Detox, and she learned this from a doctor friend of hers, that she could lose those 5 pounds it took a couple months. It wasn't an overnight thing, but it's all because receptors are working more effectively and hormones are working more effectively.
That's totally true. And I've been getting lots of feedback from different doctors. Jen Goldstock, a nurse practitioner up in New York, just told me she had a patient who couldn't lose that last 5 to 7 pounds. And she went on Receptor Detox weekends, 2 weekends in a row, and she lost that weight 2 weekends in a row. And the reason I designed this product is I was an distinguished estrogen scholar at an estrogen think tank at Tulane. And I worked with the scientists who first discovered how hormones work. And hormones, first we learned, send signals to satellite dishes, which are called receptors. But we live in a dirty world, and if these receptors are filled with dirty pollutants, like most of us have, bisphenol A, heavy metals, forever chemicals, etc., PCBs, what happens is even though you have perfect hormone levels, if you test them through whatever way, the hormone cannot deliver the signal. So to have healthy hormones today, everybody needs to house clean, or detox is the word we use in the United States, the verb, to detox these satellite dishes or receptors so hormones are then able to deliver their signals. So I designed a product with Biotics because they're the best company that I knew, and they have such from A to Z quality control and 7 scientists that work on their team. So I decided to pitch this to them, and I became their first female formulator, their first female speaker, and now we've got this incredible product called Receptor Detox. And most people need to take 2 twice a day with food. You got to take it with food because there's a little bit of full flush niacin, so you can get a little bit of flush, but your body accommodates after a few days. But on the weekends, you could do the simplest, most effective weekend detox, which is 4 twice a day. 4 twice a day after a full meal, and try to eat organically that weekend. So you're trying to get the pollutants out of you, try and minimize it coming into you. And that has been a win-win for patients and providers alike.
Now, you mentioned that at the first of the year, you had all your patients, and especially some of your cancer patients, your breast cancer patients, do this. Did you get any feedback from them after doing that? Because I know you've got quite a few on there.
So I have about 55 active breast cancer patients. I work as an adjunctive provider, and I recommended everybody do, for the start of the year, Receptor Detox weekends every single weekend in January. And we invited many people on my Substack to come, and I encourage people to take their picture at the beginning of the month, and then after 4 detox weekends, take it again, because you'll notice that your circulation is better, your skin looks better, you look a little bit younger, a little bit leaner. And we got really great feedback, and a lot of people just continue to do 1 weekend of detox weekends, which is 4 twice a day of Receptor Detox on Saturday and Sunday. But if we have ill patients or hormonally driven diseases such as breast cancer, uterine cancer, etc., we often have them continue to do 2 weekends a month just to keep their hormones working optimally.
Okay. Well, when you hear hormones, we never really think that insulin is a hormone. And some of the reasons why people can lose weight when they do this is it clears the thyroid receptor hormones, the thyroid receptors as well. So there's so many effects if you're cleaning receptors throughout the entire body, but especially insulin, because I've heard people that their blood sugar starts coming down to normal, which is they've tried all kinds of things and nothing works, and all of a sudden their blood sugar is normal.
You shared with me that physician that had a patient with really high levels. He had type 2 diabetes and he didn't really want to go on insulin. And he went on Receptor Detox and he did it twice a day regularly with a few detox weekends. And in 2 weeks, I think you said the provider said his blood sugar came down for the first time into a more normal range. So all hormones signal receptors. We've now learned that hormones do some other cool stuff, but insulin is a hormone, thyroid is a hormone, oxytocin, the love hormone that makes you feel good and makes you not so inflamed. Estrogen, progesterone, testosterone, DHEA, pregnenolone, they are all hormones. And many times we can't get our hormones to work well because actually the receptors are clogged with pollutants. So this is an easy but effective answer.
Well, Dr. Burks, it's always a pleasure. Thank you so much for joining us.
And if people are interested in finding out exactly how to use this product, at my website, drlindsayberkston.com, in the menu bar, there's a little area that says products. And if you go down the menu bar to Biotics products, you can look up the protocols of using these products for a multitude number of issues.
That's awesome because it goes so far beyond just the hormones that we think about. So that's awesome. I appreciate you. Have a great day.